Water is added to the body by the following sources, except A. Via ingestion in the form of liquids, B. Water in the food, C. As a result of oxidation of carbohydrates, D. Through diffusion. Intake of water, however, is highly variable among different people and even within the same person on different days, depending on all of the following but one. A. Climate, B. Habits, C. Level of physical activity, D. Osmosis. The following are types of body fluids, except A. Blood, B. Sweat, C. Synovial fluid, D. Cerebrospinal fluid. The most important means by which the body maintains a balance between water intake and output, as well as a balance between intake and output of most electrolytes in the body, is by A. Insensible water loss, B. Controlling the rate at which the kidney excretes these substances, C. By regulating of sweating, D. By the taste center. The total body fluid is distributed mainly between two compartments: A. The extracellular fluid and the intercellular fluid, B. Extracellular fluid and the synovial fluid, C. The interstitial fluid and the peritoneal fluid, D. A and C only. The extracellular fluid is divided into the interstitial fluid and A. Synovial fluid, B. Cerebrospinal fluid, C. Blood plasma, D. Serum. The fluid found in synovium, peritoneum, pericardial, and the intraocular spaces, as well as the cerebrospinal fluid, is referred to as A. Intracellular fluid, B. Transcellular fluid, C. Intercellular fluid, D. None of the above. Insensible water loss means A. Some of the water losses cannot be precisely regulated. B. Some of the water losses can be regulated, but we chose. C. We are not consciously aware of it, even though it occurs continually in all living humans. D. A and C. The total amount of water in an adult of 70 kg is about A. 70%, B. 60%, C. 50%, D. 80%. In insensible water loss, there is a continuous loss of water by A. Evaporation from the respiratory tract and diffusion through the skin. B. Evaporation from the intestine and diffusion through the skin. C. Conduction during fever. D. B and C only. The extracellular fluid constitutes about dash of the 60% of 70 kg adult weight. A. 45%, B. 55%, C. 60%, D. 20%. The insensible water loss through the skin occurs independently of sweating and is present even in people who are born without sweat glands. A. True. B. False. C. A and B only. Which of the following is more abundant in the intracellular fluid compartment? A. Sodium ion. B. Potassium ion. C. Sodium ion. D. Potassium. The fetus has very high total body water, which gradually decreases to approximately 75% of body weight for a term infant. But premature infants have A. Low total body water, B. High total body water, C. Stable total body water, D. Decreasing total body water. Which of the following is not an isotonic solution? A. 0.9% sodium chloride, B. 1.5 urea, C. 5.3% glucose, D. 10% sodium chloride. The pH of extracellular fluid is about A. 6.4, B. 7.4, C. 5.4, D. 7.0. The organic components of body fluids are A. Glucose, hormones, enzymes, fatty acid and sodium, B. Glucose, amino acid, chlorine, C. Glucose, amino acid, hormones, enzymes, fatty acid, D. Hormones, enzymes, fatty acids and chloride. As a person grows older, the percentage of total body weight that is water is dash. A. Decreases. B. Increases. C. Remains unstable. D. Unaffected. Which of the following is correct about body fluids? A. Women normally have more body fat than men. They contain slightly less water than men. B. Men drink more water than women, thus have more water than women. Water balance is all about intake of water. D. Intracellular fluid is measured with radioactive iodine. Five percent glucose in water solution is A. Isotonic solution, B. Hypotonic solution, C. Hypertonic solution, D. None of the above. Gastrointestinal water loss are accompanied by electrolyte loss and thus may cause disturbances in intravascular volume and electrolyte concentrations. Gastrointestinal losses are often associated with loss of potassium, leading to A. Hypokalemia, B. Hypovolemia, C. Hyponatremia, D. Hypothermia. Solutions of sodium chloride with a concentration of less than 0.9% is A. Isotonic, B. Hypotonic, C. Hypotonic, D. Highly concentrated. At puberty, the fat content of females increases more than that of males, who acquires more muscle mass than females, because fat has very low water concentration. Therefore, which of the following is not correct? A. Total body water in males remain at 60%. B. Total body water in females decreases to approximately 50% of body weight. C. Males have higher water than females. D. Males have less water than females. Conditions that can cause hyponatremia owing to loss of sodium chloride include A. Diarrhea and vomiting, B. Excessive urination, C. Polydipsia, D. Diabetes mellitus. The following are used to measure the extracellular fluid in the body, except A. Inulin, B. Thiosulfate, C. Radioactive sodium and chlorine, D. Heavy water. emesis causes dash: metabolic alkalosis, B. metabolic acidosis, C. hyponatremia, D. hydration. Total body water is measured using the following except A. Antipyrine, B. radioactive water, C. thiosulfate, D. ditchroom water. Poor water intake such as may occur with diarrhea condition and poor oral intake due to anorexia or emesis causes A. hypernatremic dehydration, B. hypernatremic dehydration, C. hypokalemic dehydration, D. hypokalemic dehydration. The maximum fluid rate is normally A. 100 ml per hour, B. 200 ml per hour, C. 150 ml per hour, D. 300 ml per hour. In children with hypoalbuminemia, the decreased occultic pressure of the intravascular fluid contributes to the development of A. Pyrexia, B. edema, C. rigor, D. diarrhea.